Hello, my name is Livy Solis, and I'll be talking about Canada's healthcare system. For the first section, this is about coverage. Canadian Medicare is a decentralized, publicly funded universal healthcare system. It was established through federal legislation, originally passed in 1957 and in 1966. It covers services that are medically necessary. When it comes to quality, a lot of the concerns when it comes to universal payer are limiting access, choice and quality in healthcare, and wait times. Other issues are health disparities, how this coverage can affect it. In 2017, 92% of physicians worked in an urban setting. There are no governmental efforts to ensure that doctors are available in rural and distant areas, but most provinces, on the other hand, have rural practice initiatives. The use of financial incentives to improve quality is limited. At the physician level, they have had to date little demonstrable effect on quality. Coverage is only covered if it's deemed medically necessary, but each province territory gets to decide what medically necessary means, and if patients want to have procedures or services that are not covered with this insurance, they have the option to purchase private insurance, which could cover like cosmetic procedures or vision. And one of the main issues that's widely talked about when it comes to universal healthcare is wait times. So, what I found interesting was that in 2016, the Commonwealth Fund placed Canada last out of 11 countries in terms of specialty care wait times. Wait times have been reported to cause worry, anxiety, pain, loss of income, delays in diagnosis and treatment, test duplications, and deterioration in patients' health by roughly one-fifth of Canadians. However, there are other countries that have a similar healthcare model, but what these countries do differently and why they're more successful than Canada is that they allow the private sector to provide core healthcare insurances and services, and they require patients to share in the cost of treatment and fund hospitals based on activity. Some suggestions for improvement could be to initiate benchmarking as a policy tool. For example, Sweden suggests that 60 days and New Zealand 6 months as the maximum acceptable length of time between referral and first specialist assessment. When it comes to cost, Canadians pay for their healthcare through taxes. The main funding source is general government revenue. An estimated 37 billion or in US dollars 29.4 billion in 2017-2018 is provided by the Canada Healthcare Transfer, the federal program that funds healthcare for provinces and territories. Each health insurance plan covers all medically necessary hospital and physician services. Provinces and territories cover all their own residents in accordance with their respective residency requirements. Each province has its own insurance plan, and each receives cash assistance from the federal government on a per capita basis. When it comes to cost sharing and out-of-pocket spending, there is no cost sharing for publicly insured physician, diagnostic, and hospital services. Physicians are not allowed to charge patients prices above the negotiated fee schedule, and fee-for-service is the primary form of payment. In 2017, overall health spending was predicted to be 11.5% of GDP, with the public and private sectors accounting for roughly 70% and 30% of total healthcare spending. Another interesting fact that I found was that physician education in the workforce, students who obtain a medical degree from one of Canada's 17 public medical schools, they pay an average annual tuition of $11,730, and that was back in 2018 and 2019, which is significantly cheaper than what a medical student would pay in the United States. And finally, choice. Do consumers have a choice of insurance healthcare providers? Well, they have a very limited choice. The majority of citizens are covered under a universal payer system. They have free choice of a general practitioner in practice. However, patients may not be accepted into a physician's practice if the physician has a closed list. Private insurance is held by about 2/3 of Canadians. In 2017, private insurance was estimated to account for 12% of total health spending. And interesting fact that I found when it comes to choice is that private insurance for medically necessary hospital and physician services is banned in 6 of the 10 provinces. This was back in 2001. I couldn't find any more up-to-date information, so it might have changed. But the lack of a strong private sector is most likely due to limitations on public plans subsidizing private practice, which prevents doctors from supplementing their public sector salary with private fees. But at any point, a Canadian physician may opt to give up his or her privilege to charge the public plan and practice in the private sector. Thank you guys for listening.